So welcome everyone. My name is Morgan Greenleaf. I run Innovation Catalyst over at Emory University and also part of the Georgia CTSA. And today we have one of our Bench2Market talks on investment and dilution. And this talk is sponsored by Biolocity, the Georgia Tech Pettit Institute for Bioengineering and Bioscience, and the Georgia CTSA. A couple just announcements before we get started into the main talk. We do have legal office hours as part of the Biolocity program. So if you are a startup or you're thinking about starting a startup and you have legal questions, you can take advantage of these free office hours from Professor Nicole Morris over at the Emory School of Law. So please take advantage of that. It is free. We also have, as part of Biolocity, these innovation office hours. So these are staffed by entrepreneurs and residents from the community, and these are also free, and you just need to sign up, and you can come and chat with people who have started companies, people in the industry, people who may have experience in your specific vertical. One funding opportunity to announce is from BARDA, and the Biolocity is part of the BARDA Drive network. So you can take a look on the Biolocity website, biolocity.org. There's a number of funding announcements there specifically from BARDA for startups coming out of academia. Last announcement is about Lab to Launch. So if you don't know, Lab to Launch is a really capital efficient, aka subsidized laboratory startup space. I don't want to call it an incubator because it's not an incubator, but it is a physical space within the new Health Science Research Building 2 or HSRB 2, beautiful space. And it's subsidized by the Emory School of Medicine, so there are benches, there are private suites. You can come rent even just one knee hole and start your company there right within Emory. And one little fun tidbit is that the address is actually separate, so you can have a business address versus being located at Emory, so you can be a separate business. And if you want to apply, there's an application process on the Emory School of Medicine website, or you can contact the director of that program, who is Harry Gerard, directly. Our next talk is going to be on FDA regulatory strategies. This will be February 14th, 11:30 to 12:30, and this will be virtual only. So if you're interested about regulatory strategy, you can come hear that talk. And last but not least, we have today's talk, which is on investment and dilution, business strategies for equity negotiations. And we have the famous James Stubbs speaking today, who is a professor of the practice here at Georgia Tech and also leads the BME Capstone program. I'll just say briefly that he has a very experienced background, both as an innovator, as an academic, and as an angel investor. So he speaks on this topic from a great depth of experience. So welcome, James.
Great. Thank you, Morgan. So I'm going to make the same request that Morgan just did. If somebody online in the chat, Randy or Jake, could just do a real quick thing saying you can hear me, because I'm on a different microphone.
See a thumbs up.
Thumbs up is always good. So I'm going to grab the slide advancer and I'm going to get moving. So what I wanted to do this morning is talk a little bit about financing and dilution in startup companies. And I'm going to get started with just a little bit about myself. There's a lot of junk on this slide, so I'm not going to go through it in a lot of detail. But right now, I'm currently what they call a professor of the practice. So I'm part of the teaching faculty. That's all I do. I teach senior design, and I play a little bit in an organization called CreateX in their summer launch, which is a lot of fun. Those of you who have startups or ideas for a startup, you want to do that, the CreateX program is awesome here. So I'm going to give a little shout out to them. So my background is a little bit of, I'm a nuclear engineer by education and training, but I went over into the dark side and started doing radioactive drugs as part of my graduate work, both master's and Ph.D., and then worked for as a contractor for the FDA after that, evaluating radioactive drug safety. And from there, that sort of led me into morphing from drugs over to medical devices, but it was still using that same sort of skill set. So it was all about how do you use radiation for diagnostic and therapeutic purposes. So the first company that I was involved in, I was the CTO as well as the VP of Scientific Affairs, is Proxima Therapeutics. And we made two different products. One was for neuro-oncology, treating brain tumors, and the other one was for breast cancer treatment. And I'll show you a couple of pictures of what those products were in just a minute. That company was acquired by Cytech Surgical Products, and they moved me out to California. And we were a women's health company, and that's what we did there. And that was fun. And then, you know, I lasted, in fact, everybody who was part of that Cytech Surgical Products division, we lasted about 18 months. And then they came in, it was a Boston-based company, and we were in Palo Alto. And they decided they didn't really necessarily care for the culture that we had in the Bay Area, which was Hawaiian shirts and jeans. And they were from Boston. They looked like they were IBMers. So they came in and they fired us all. And that was great because 2 days later I started Focal Therapeutics, which was another breast radiation therapy and breast surgery company. So that was like one of the most awesome things that ever happened. From there, I went on to be the Chief Science Officer for Sienna Medical, which is another women's health breast cancer company. I started a company called Andare Therapeutics, which was going to be doing a Class 3 medical device. And boy, did I learn a lesson from that one. That is a rough road to go down because you have to raise so much money and the market opportunity has to be so big for that to actually be attractive to investors that we were ultimately never able to get it up and going fully, so I ended up shutting that down. Finally, in 2014, after finally retiring from the operating roles, I moved into the investing area. So I started up with the local group, the Atlanta Technology Angels, and it turns out they were seeing life science companies come through and they just didn't have a good feel for how to evaluate them because they were used to financial technology, software as a service, and things of that nature. So I started the life science vertical, and we started a formal screening process. And one of the first companies that came through, we actually made an investment in OB Medical Company. And as part of that, we syndicated that deal across multiple angel groups. And because we did this syndication and we pooled all of these multiple investors from Alabama, Georgia, and South Carolina together, we had enough of a piece of that round that we were able to get a board position on the company, not an observer, but a full board seat. And they put me on the board, which was it turned into one of the most excruciatingly painful things I've ever done because that company ended up had to be turned around. And we had to do a lot of things to right size it, firing the CEO, chief operating officer, and replacing a lot of the staff to get it going. But at the end of the day, we did sell Proxima Therapeutics for $200 million. Focal Therapeutics was sold in 2018 for $125 million. And Sienna Medical also got sold in 2018 for about now $225 million after all the earnouts over the last 5 years. OB Medical, believe it or not, got acquired for $27 million on $100,000 revenue. The reason they did that is we were bought by Philips, and GE had bought our direct competitor making exactly the same thing we did for $28 million. And so Philips knew that if they didn't acquire us as the only alternative to go from fully wired labor and delivery monitoring to wireless labor and delivery monitoring, GE was liable to buy us and they were going to be shut out. So it was a strategic acquisition, which violated all of the rules of normal valuation for acquisition purposes. We can talk about that kind of stuff if you want to later, because those rules and rules of thumbs just go up and down as time goes by. But anyway, in the space of 30 days, I had 3 companies get acquired. It was like a head-spinning 2018. Now we're going to just take a look at some of the devices. So these are some of the devices that we did at the first company. So This is a balloon catheter system you would fill with radioactive fluid, and it would go into a resected brain tumor cavity and deliver a course of radiation therapy. And it would do it in 5 days instead of 5 or 6 weeks, and you could do this 2 times or 3 times instead of just usually the 1 course of external beam radiation therapy. It was a local therapy, which over the last 20 to 25 years, you've seen more and more movement into the personalized medicine, going from full open surgery to laparoscopic surgery to minimally invasive surgery. And to a lot of cases, we're actually doing things like stereotactic radiosurgery where we're not even penetrating the skin with a mechanical device and we're ablating small, tumoritis or doing other lesion creation just by focusing different types of energy onto a very, very tiny location in different parts of the body. That was, at the time, there was no predicate for it. So the FDA didn't know what to do with it. So we took multiple class 2 predicates and tied them together, and they made us do a clinical study, which at the time you didn't have to do. If you had a classic 510K, you never had to do a clinical study because you were substantially equivalent to something else. The FDA looked at that and said, there's nothing like this. But the risk on it is not rising to the level of a class 3 device. So they made us do that. This is before the de novo pathway came into being. And I don't think we were the genesis for the de novo pathway, but we certainly were the poster child for what they should have done with us. This is the breast device that company had. We ended up using the brain device, which was a radiation therapy device going into a body cavity after a tumor was taken out, and we used that as a predicate for our breast radiation therapy device. And the FDA said, all right, you're class 2, but we're going to make you do a clinical study on that one as well. So we effectively were treated as though we were de novo class 2 on that one as well. You may remember I talked a little bit about focal therapeutics, the great reason to get fired. This is a device that you can see right here. It is a bioabsorbable material with some titanium clips in it. And it goes into a lumpectomy cavity after that lumpectomy has been performed. And it provides a target that radiation therapy can now aim at that original tumor location. And the clips will mark it permanently. So the radiologist who's doing mammograms later on for the next 20 years for your patient knows exactly what area of the breast is at greatest risk of recurrence. So this was a company that I started. You can see down here, there's the clips inside what is the former lumpectomy cavity. This was a really fun one to do. And this is a topic for another time for y'all. But this whole idea of coming up with a target for radiation therapy that would fill the breast cavity that was created came from the fact that on the prior company, Proxima Therapeutics, I was in breast surgery and radiation therapy with our products for probably 200 or 300 different physicians, training them how to use it. And I heard both of them talking about, if I only had this, we could do X, Y, Z. If I had this, I'd get better cosmetic outcomes. And it was because, as an engineer, I'm sitting there looking at the intersection of 2 different specialties and how they complained bitterly about each other. That was the result that's where this product came from. And that's what made that kind of fun. So spending time with your customers is super important because you'll learn exactly what they need. That's a topic for another day, though.
It's still in use?
That is still in use. In fact, all of the brain tumor device is not in use in the United States. I think it's still used in Germany, though. It is very expensive. I'm on the boards of 2 companies right now that are venture-backed. One of them is Oxos Medical. It's here in Midtown. I'm the chairman of the board of that company. And we make a handheld digital radiology system. So it replaces the conventional C-arm for orthopedic surgeons. We just received our 2nd FDA clearance. So we're really excited about the launch of the 2nd generation of that product. And I'm also on the board of Restore 3D, where we custom make 3D printed replacement body parts. So we can make knees, ankles, shoulders, hips, just about anything you can think of. If you need a new jaw, half of your jaw, we can make that too. So that's been really fun with those 2. Those 2 companies have, Oxos recently raised $46 million just about 6 months ago in venture capital. And Restored is about to do our first Series A, which is also going to be a fairly significant amount of money, and we look to close that probably in the next week or so. These are some of the exceptions in the healthcare space that are straight up devices that are still not having an issue raising money. And that's what we're going to talk about more today, is at the really early stage where you're raising money from angel investors and Series A venture capitalists. That's what we're going to talk about. But I'll also talk about dilution and what happens to you as founders with the amount of stock that you own as you start raising money and taking your company forward. So we're going to first just start off with some very, very basic concepts about corporate structure and what are the limitations on each of the corporate structures and what you can do with those. The first one everybody's probably heard of is the LLC, the Limited Liability Corporation. This is how you often get started, but this is not where you're going to be as soon as you start trying to raise money. This is a pass-through entity, just like the S-Corp, which is the next one. S-Corps and LLCs are great for their purposes, but they're mainly for what we call lifestyle businesses, or ways to protect either your assets or to protect you as the owner from liabilities from some ongoing operating activities that you're doing. So neither of these are going to be used if you're trying to raise investor money. Investors are going to, there's the reason for the corporate structures that is used, and it's called the C Corp. And that's what we're going to spend a little time talking about. There's been multiple cases where you start your company as an LLC or as a C Corp or an S Corp, and as soon as you start getting any investors involved, the first thing they're going to tell you is you got to convert to a C Corp, and it's usually a Delaware C Corp. For those of you who are in Georgia, there are some advantages to incorporating as a Georgia C Corp and keeping it that way for a limited number of years. There's some tax benefits from the state level if you do that. There's also something that if I don't mention it, don't let me forget to talk about Invest Georgia. Okay. Have you heard of them? No. Okay, this is something that's really a brand new thing, and it's really awesome for us. So I'll just remind me if I don't get to that a little bit later. So here's the thing to remember. As soon as you take money from an investor, their expectation is they're going to make multiples on that at some point in the future. So if you take $100,000 from an angel investor, in their mind, they're thinking 20x or 40x is the return they're going to get on that at some point, maybe 5, 6, 7, 8 years down the road. The multiple gets smaller the later you are in the financing. So if you do an angel round, it's high. If you go to the seed round, the expectation gets a little lower. Series A, maybe it's a 3x, 4x, 5x. By the time, if you need to do a Series C, they're really expecting you to try to close that company out, get it liquid, get it acquired within a year or two, and they're still expecting a 2x to 3x on that. And for those of you who've been investing in Wall Street and stuff like that, do you expect to get a 2x return in a year on anything? You shouldn't expect to. You might if you drop your money on, say, Tesla back when it was $25 a share, then you can make some money. But most of the time, you don't get that. You have to put your money at almost complete and total risk of losing it to get those types of returns. So we'll hit a few of the pros and cons on the C Corps. One of the biggest one, every company that's on the stock exchange is a C Corp. They can have an unlimited number of investors. An S Corp, for example, has a limitation of, I think, no more than 500 shareholders. That's pretty unwieldy as it is. But the other part about C Corps is they can have multiple share classes. When you start your company, you're going to own common stock. And as you start to get investors in at the Series A level and Series B, they're going to own and they're going to require preferred shares. Preferred shares have a number of advantages that we'll hit on in just a minute. But you can have different levels, different types of shares, and you can also have stock options. You can have restricted stock. There's a lot of really cool things that you can use in your toolkit to motivate employees as you hire them into your startup when you have a C Corp. There can also be some federal tax benefits if you're a C Corp and you've been in business for 5 years and then your company gets acquired, you're a qualified small business. Guess what your federal tax rate will be on your shareholders who've held qualified small business stock for 5 years? 0. This is beautiful. The stock that I held in Sienna Medical when it was acquired, I paid no tax on the capital gains on it. Focal Therapeutics, which started before that law went into place, my first 2 rounds, my common shares, my Series A shares were subject to, I think, a 50% exclusion. Then the B and the C round shares I had were subject to just a 25% exclusion. My Series D money that I put into that company was completely free of federal tax. This is just awesome. And in the space that most of us are probably in, and I'm guessing most of us are in healthcare, right? Would that be safe to say? It's going to take you more than 5 years to get your startup liquid. It's an expectation you should have. It just will take it that long. Venture capitalists cannot invest in pass-through entities like the S Corp and an LLC. They can only do it in a C Corp. That's probably the fundamental basic reason why you're going to end up going with a C Corp. Delaware C Corp as opposed to a Georgia C Corp, this is the standard. If you start yours as a Georgia C Corp, as soon as you go get venture investors, they're going to make you swap it over to a Delaware C Corp. That's okay. Delaware just has some of the most business-friendly legislation and regulations in the country. That's why most of our companies end up being Delaware C Corps. All of the big companies, almost all the big companies that you're familiar with, Apple and so forth, they're going to be Delaware C Corps. All right. Disadvantages, there's really none other than it's a corporate structure that's complicated enough that you're going to have somebody doing the taxes and handling some of that stuff once you get to any level of size on them. All right, so probably what you've all been looking for is cash for the venture, and how do you go about raising it? Well, the amount you raise is going to vary by what stage you are in your venture and what are you going to do with that money. And the amount of money that it takes for you to raise is going to depend a little bit in our field on what's your regulatory classification for your device. Like if you're a Class 1 device, you can move through the FDA process really fast. If you're a Class 2 device, you should probably expect just going through design-controlled product development is probably going to take you 1.5 to 2 years minimum. If you're a Class 3, it's going to take you 8, 9, 10 years because you're going to have to run a monster pivotal clinical study to get FDA approval for that. So all of those things, the more time it takes and the more patients you have to do clinical work on, the more expensive it is, the more money you're going to have to raise. Now, it also will depend on what type of commercial launch you want to do. So the classic thing for a lot of us startups is we want to raise as little money as possible because you get diluted. The more money you bring in, the more ownership you give away, and that comes out of you founders' equity shares. So what ends up happening is if you do distributors, other people who are calling on the surgeons or the hospitals already with a product that's in the same space. Let's say you're doing an orthopedic surgery device. You can get some orthopedic surgery distributors. They've already got the salespeople that are in the call points in different parts of the country. You can have them sell for you. Then you just basically do either a commission split or a revenue split or something of that nature, as opposed to hiring your own sales force. You can do that. That is a lot more capital intensive because you have to hire people. The most expensive thing you're going to do in your companies is going to be headcount. The more people you hire, the more cash you're going to burn. Then comes clinical studies after that. You can also make deals with strategic partners like an Ethicon Endosurgery. If you're doing a surgical product and you want to sell it, you can strike a deal where maybe you take some investment money from Ethicon Endosurgery, and in return, in addition to owning stock in your company, they get the right to distribute your product, say, in the United States. There's pros and cons to that. It's a pretty interesting analysis that you'll have to do. So watch out for that one. Independent distributors are a little bit better, but there's a few things to just be wary of that. There's a lot of people out there who've done this before, and they can talk to you about how to do it. The thing I like about having my own sales force is they belong to you. You can tell them what to do, and you own the customer because they're in with the customers every day, and they're able to come back and tell you, here's what they want, here's what they're complaining about. And you have your hand on the pulse of your customers. It's more expensive, yes, but the sales team for the breast surgery device that we had at Proxima, they came back and did focal with me, and they went to Sienna Medical. It's like a big family reunion. I still know these people, and it's going back to like 1999. So they had the relationships. It was awesome, but it was more expensive. Now, there's two broad types of financing. There's non-dilutive, and as it may sound like, that's grants, people giving you money for some reason. Invest Georgia, not like that. Some money you can get from the Georgia Research Alliance, which we'll touch on, can be non-dilutive, but most of the financing you're going to do is equity-based. They're giving you cash, you're giving them part of your company. So let's hit the non-dilutive really quickly because we can dispense with that one fairly fast. So this is where you get money from foundations, like let's say that's the Juvenile Diabetes Foundation. Maybe you're developing something for kids with diabetes. They may give you a grant. You might be able to get grants from SBIR or STTR. Those are Small Business Innovative Research and Small Business Technology Transfer grants. They're both getting their buckets of money from places like National Science Foundation or NIH. And that's a grant. That's free. That's beautiful money to get. It's interesting you mentioned BARDA. One of the companies I'm on the board of, we're going to be putting in a grant application to BARDA.
BARDA's actually a big funder now, particularly after COVID. Actually, before COVID too, a lot of like pandemic preparedness stuff.
That's, I mean, it's so great to know about that.
Niche that they play a big role.
Yeah, but where they're in, they are a gorilla now. It's awesome. So I'm glad you're bringing that up, that's available to people. For those of you who are in Georgia, and I know at least one or two of you online are not here in Georgia, we have a thing called the Georgia Research Alliance that you can access. And they have both grant programs and then some equity-based programs as well as some venture debt at that. There's another program that it's where the money for Invest Georgia comes from. It's actually a Department of Commerce. They had something like a $1 billion grant, and they dispersed it out to the individual states based on like the population of it. Georgia got $50 million, and that becomes another vehicle that you can get dilutive funding. But the way that one works really quickly is if you're doing a priced round, like a Series A, and you've got investors who are professional, venture investors, they will match what you bring in. So if you do a $2 million round, they'll match it with $2 million under the exact same terms. This is beyond wonderful because raising money is a real pain in the rear. It's very difficult, it's very time consuming. Yes?
What was the name of that?
It's here in Georgia, it's called Invest Georgia. If you want to, just let me know. I can give you an introduction. Knox Massey runs it, and he's the guy that you would want to talk to. I think right now it's $50 million that they got in the bucket, so I don't know if that's going to be coming back year after year after year. I would doubt it unless something changes legislatively. Yeah. The SBIR program is different because that's a specific allocation of NIH or NSF budget that's directed every single year into those programs. All right. If you're doing an SBIR or STTR, there's a resource at ATDC in Tech Square. Connie Castile, she is the grant expert. She can help find the proper proposal sources and help you out with structuring that grant application. So be sure you take advantage of ATDC if you're here in Georgia.
Can I do one more plug?
Sure.
I don't know if people can hear me, but so the UGA also won a grant from the Small Business Administration to support SBIR and STTR consultants. It's called a Phase 0 grant. So they give out like 10 of these per year. So you can apply on the UGA website, send it out afterwards, and they will provide up to $2,400 to hire a grant consultant, professional who does this to help you write your SBIR or STTR grant.
That's great. So if anybody has an interest in the new UGA program for SBIR, STTR grant consultants, contact Morgan Greenleaf and he can get you connected with the people at UGA that are doing that. Awesome. All right, so as you're in the early stages, the first money you're going to bring in more than likely is going to come in the form of a convertible note or a safe note. So we'll talk about convertible notes first. This is a debt instrument. And one of the things that has changed because of the interest rate environment, what this really has is you've got investors who are starting off, they're going to loan you money, and that's why it's called a convertible note. But the idea here is that loan, like if maybe they give you $100,000, it's going to have a term. It's going to have an interest rate that until this converts into stock, it's going to be earning interest. So it'll convert, the principal and interest will convert at some date in the future when you do a qualified financing with like a venture capitalist. It'll have a cap and term on that, meaning that if they put in $100,000 now and you've got, say, maybe a $4 or $6 million cap on it, and you raise money at a pre-money value that's higher than that, like $8 million, those investors, they actually get to convert at a lower share price. So they get more stock than the people who came in later do. They're putting more at risk earlier, so they get some additional payoff. In addition to the cap, they may get a discount. So there may be a 10-20% discount to whatever the share price is if they don't hit the cap. So usually you get one or the other as one of those early investors, but not both of those. Typically, the cap and term right now, I don't think I've seen any convertible notes on even first round funded startups out of this ecosystem that are under $6 million pre-money, a cap of $6 million right now. So some of these things, they're going up with inflation and things of that nature. Interest rates, again, they're going 8 to 12, 14% now. That's just robbery. 14% interest is just horrible. Now, you might think, well, this is a debt instrument. Do these things ever get paid in cash when you do a venture financing, a Series A down the road? No. And the people who are putting money in a convertible note, they don't want their money back because they don't want an 8% return on their money. They want it to go in and 5 or 6 years later get a 20x on their money. That's what they're gunning for. So they don't want you to pay it back. And the people who are putting in that qualified financing round, they don't want you taking their money and paying somebody else off. They want all that money going into pushing your company forward. So that's sort of what's happening. So when you do that qualified financing, their money turns into the same class of shares that are going into the qualified financing, which is usually like a Series A type of thing. So it'd be Series A preferred shares. When that happens and that converts, that debt is wiped out. So that has an impact on your balance sheet, but from an operating perspective, it makes no difference to you. It just doesn't, because you're not making payments of interest or anything like that on these notes. It's just gone. You're using it for working capital, and that's it. You're not paying anybody. The interest just accrues over time. These things can have a very complicated effect on your cap table. For those of you who don't know, that's called your capitalization table. It's basically a listing of everybody who owns stock in your company. These things can be really complicated trying to work out what happens on your cap table because it ends up being some circular references on the spreadsheet when the new financing comes in. And it really requires somebody who knows what they're doing to get that worked out. There's an alternate vehicle that's been picking up a lot of traction that we're going to talk about next. So convertible notes, they're non-dilutive. You're not giving up any equity on a convertible note until it converts into like Series A preferred. So there's no impact on your dilution until that event happens. Now, is any of you aware of or familiar with Y Combinator? So yeah, those guys are awesome out there. They've got a YouTube channel that if you want to see how they do things in Y Combinator and give you a lot of insight into entrepreneurial behavior and stuff like that, just check them out. It's great. But one of the big things that they did is they've developed some standard safe notes. A safe is a secure agreement for future equity. It's kind of like a convertible note, but kind of not like a convertible note. It's got some good things, it's got some bad things. There's some angel investors here in Atlanta will not do safe notes because there's no guarantee they're ever going to convert into equity or quote unquote. They are quote unquote equity from the day you issue it, but there's no guarantee it's ever going to turn into something because it's just not part of the legal requirements on it. That's getting into the weeds on it. That's probably the one thing that a lot of angel investors don't like. So just be aware of that. There are about 3 or 4 major different types of safe notes, and they have to do, does it have a cap and no interest? Does it have an interest rate and no cap? Does it have MFN, which is the most favored nation status? You're going to hear that term bandied about a lot. If you're out trying to raise money from multiple investors at the same time, and you get a term sheet from one, and it has, for example, a cap of $6 million, and you get a term sheet from somebody else, and it's $5 million. Well, the $5 million cap is better for the investor, and it's worse for you. But if you end up accepting that one, you have to give it to everybody else too. Because otherwise, you will have violated that most favored nation status. And that's what the big investors all want. They don't want to be put at some kind of disadvantage when they put in money at exactly the same time as somebody else. So this safe note will be converted into exactly the same type of equity under whatever terms the different safe notes have. This slide deck's available to anybody who wants it. These are hyperlinked so that you can go straight to the Y Combinator site and see what they are. They actually put in a thing in there that you can't change the terms, the legal terms in these safe notes without it basically blowing up the Word document. So that they're trying to create a way that there's no way that somebody can sort of game that system and put in a little wrinkle that's not easily noticed. So the Y Combinator safe notes, they're sort of industry standard at this point.
Can I ask you a question?
Yeah.
Like, is the safe note better? Is it as clear cut as it's better for the startup, better for the founders, or better? Like, why?
The safe note is better for the founders. Yeah, and then part of it is you can understand exactly what's happening to your cap table when you accept a safe note, because you're accepting it with a pre-money cap on it or a post-money cap on it. And let's say that you take $60,000. This is a direct example from my experience a couple years ago. I put $60,000 into a startup with a $6 million cap on their safe note. No matter what they did, I owned 1% of that company. If they raised money at double that cap, I still owned 1% of the company. So from an investor standpoint, it has some advantages. From the entrepreneur's standpoint, their cap table doesn't have that circular sort of calculation that's involved in it. Everything's spelled out very, very clearly with it. It's not the easiest thing to directly explain. I'll show you the cover of a book that's my go-to on all things related to financing, and they explain it super well in there. All right, so let's take a look at some of the rounds that you're going to do as you get this thing going. So pre-seed round, FF&F, that's friends, families, and fools. That's what that's commonly referred to, because you're putting money into things. It's a flyer at that point, more than likely. Then you get into what they call seed rounds. This is where your angels jump in. Some of this has changed a little bit. A lot of times the angels are going into pre-seed rounds, and then you'll get some venture capitalists who are willing to take a little more risk. They'll do something they call a seed round. All these things are really just predicated on how much money these rounds, how large they are. That's really all that matters. So don't let the semantics kind of mess with you. A seed round today is typically up to maybe 6 million. I mean, that's just mind-boggling. When I got started in this, $6 million was a full-on Series A, maybe even a Series B. I'll show you some data on the different rounds we did in Proxima Therapeutics right at the end. So Series A you do, then Series B, and you keep doing these series every time you run out of money until you get to the liquidity event. The liquidity event is either you sell the company, you go public, or you go out of business. Those are the three things in a liquidity event. So don't think of it as a liquidation, which normally we'd say, oh, you went out of business. Liquidity events, we look forward to them most of the time. Again, acquired or dissolved, that's it. We have done precious few initial public offerings, IPOs, in the healthcare space. There's been a few, but it is nothing like it has been in other industries. And the IPO world has really just kind of dried up over the last 4 or 5 years anyway. So that's kind of it. The biggest thing in all of this is investors are putting in their money and they're banking on you to run this company in a way that's going to get them a big return on their money. When venture capitalists put money in, what they're expecting, let's say somebody raises their pool B for their venture capital firm, and maybe it's $100 million. They're going to divide that into 10 opportunities, and they're going to take half of that 100 million and put it to work as fast as they can. And they'll take the other half, save it to put in as a second round on those same companies. Each of those venture funds that are pulled together, they have what's called a lifetime of about 10 years. So they need to pull the money in from limited partners, put it to work as fast as they can, because they need to get liquid within 10 years on all of them. And as you might have heard from me so far, 8 years, 9 years, 10 years is common for us. This can create some really conflicted venture investors on your board. If they're getting to the end of their fund's lifetime and you still got 2 or 3 years to go before you're legitimately going to get liquid, they may start putting a lot of pressure at the board level to just do a fire sale and get out of that investment. They're expecting out of those 10 investments, fully 7 of them will return 0. They will just go bust. And then you'll get 2 that are going to return maybe a 2x, 1x, 2x, and then they're getting 1 unicorn out of there that provides like 10x, 20x, and that provides the total success for that entire fund. That's what their expectation is. So they're fully expecting to lose 70% of their money, but they're going to get it all back basically on 1 out of those 10. So that's just kind of an interesting thing about them. For angel investors, again, the amounts is very early. It's usually $250,000 to about $5 million. You're going to find almost no single investor who will drop $250K. You're going to need to actually get lots of them, pool them together to do that. We'll talk in more detail about some of the ways to go about doing that in a little bit. There are some people that are called super angels that they can write a check that's $250K, $500K, maybe larger. There's not many of them. Venture capital, this is going to come after that, and we call that Series A. Those are the folks who are going to get the preferred shares. And preferred shares differ from common stock for a lot of reasons, some of which we'll talk about in a few minutes. They have preferences, and some of them are legal rights, some of them are governance rights, and some of them are economic rights. And the devil's in the details on all of those. So you'll keep doing multiple rounds, Series A, B, C, until you get that liquidity event, whichever way it happens to go for you. There are there's 2 or 3 dead methods now. And part of that is, in our industry, you are not going to do crowdsourced stuff, because most of those things require you to give a product to somebody as soon as you have it. It's going to take you years to come up with the product. You can't give somebody a medical device or a pharmaceutical or a biotech thing that's not already FDA cleared. You can't do that. So those things are just like off the table, and they're usually pretty small, several $100,000. So just don't even worry about Indiegogo, Kickstarter. Initial coin offerings, they spiked up for a few years ago, and then they have just, they're gone. SPACs were hot as pistols for quite a while, and then they blew up because a lot of them turned upside down. And a lot of the private equity firms that have developed SPACs, they pulled money in to do this special purpose acquisition corporation, which normally it's a public company and it merges with a private one, and that's how you get the money driven into it. Those things have been blowing up, and they've been actually giving the money back to those investors. So if you hear anybody talking about, we're going to do a SPAC, bullshit. Sorry. That's not going to happen. So some of the basics, because these are some of the terms that you're going to hear when you do a financing. These are all just pretty straight up. Pre-money valuation. All that means is, and for those of you who are doing startups and you're talking to like individual investors, not venture capitalists, this number is like totally fictitious. It's totally made up. You're going to propose to them, I think my company's worth $6 million today. That's my pre-money value. And they may come back and, nah, it's only worth 4 or something like that. And you'll argue over it. And it has no basis in fact. You have no revenue, which is normally how you value companies, is some multiple of revenue or some multiple of earnings. You got neither of those. You've got intellectual property. Maybe you're going after a giant market. But if you can point to other precedents, other companies that are either directly in your space or adjacent to it, and say, they raised $5 million at a $10 million, pre-money valuation, that's what we're basing it on. That's defendable. So one of the things I would take away from this is the more, to the extent you can find examples and precedents for valuation, the easier it's going to be for you to hold a proposed valuation. Because otherwise it's just a flat up negotiation. And if you're in desperate straits for money, you're on the wrong end of the leverage. If you can generate multiple investor groups that want to fund yours, you've developed what we call an auction atmosphere. And that means you can probably drive a pre-money value that's actually better than realistically you should have. This can raise some issues for you later that if you say, I can get a $12 million pre-money valuation, I'm going to jump on it. As a founder, you kind of like that because it's less dilution for you. The problem is if you don't perform or the market conditions turn around and you're raising money the next year and somebody says you're only worth $6 million, you're going to get so diluted raising that next round because that is what we call a massive down round. And so I've actually seen this in a couple of companies where they said, we can justify a $10 million pre-money valuation, but we're only going to do 7. We want to allow growth opportunity in the perceived value of the company for the next round, and those investors will be happy because, you're doing a $10 million round, 12, 14 months from now. They'll go, hey, my stock's worth more than it was before. Whereas if you started at 12 and now it's back down to 10, they're all really angry because now they're going to suffer monster dilution. So it's some of the devil's in the details on that. But anyway, pre-money value, it just translates this way. If you, for example, you said you've got a $4 million pre-money value, you're raising $1 million, your post-money value is, how many calculus majors do we have in here? It's real simple math. It just means it's $5 million. You add the two. And it means that those investors who dropped $1 million, they have $1 million out of a $5 million value, they own 20% of the company. The impact for you, Andrew, is you just lost 20% of your company. But that's okay. You now have money that you can go do lots of things that will enhance the value of your company. And if you do this correctly, the next time you go to raise money, your pre-money value may be $8, $9 million. Everybody's happy with that. All right. Here's where we get into some of the things. When you start getting the investors like the venture capitalists involved, they start asking for, as part of the preferred share package, different types of preferences. And there's a lot of different ones. Let's just start with the economic one to get the ball rolling. They're going to say, all right, we're going to put $1 million in, or we're going to put $10 million into your company. We're going to get a 1x or a 2x preference, liquidation preference on that. What that means is if you sold the company like 6 months later for $12 million, they get their 10, if they got a 1x liquidation preference, they get 10 of that 12. Then all of your common stockholders get what's left. That kind of stinks, right? For you, founders. If you sold it instead for $100 million, all they would get is $10 million. This is really pretty cool. But what they will do in a case like that where they see that they're not making as much on a ratable basis as the common stockholders, they will convert their stock, their preferred shares, into common stock, and then they'll effectively end up getting more. If they own 20% of the company in that case for $10 million, they would convert to common stock. They'd take $20 million of that $100 million. This is where the devil gets into details. When economic times are bad, like they've been for the last couple of years, that 1x liquidation preference, which is pretty common, will go up to 1.5, 2.0. The worst I've seen is 4x. That's abominable. But that's not the worst thing that they'll do to you, or they'll try to do to you. They have this lovely little thing they call participating preferred shares. And this is where not only do they get that liquidation preference, but any money that's left over after that, they convert to common stock and they get their percentage ownership of the second batch of money. This is like, the polite way to say it is having your cake and eating it too. It's also referred to as highway robbery. You do not want, unless you do not agree to participating preferred, unless you absolutely, positively have to do it to survive. Because that's just robber baron type stuff. So we don't like that stuff. Non-participating preferreds, they will get either their preference, their 1x, 2x, or they'll convert to common and ratably participate with you. Either of those is a fine outcome, especially if you get a really nice acquisition price, everybody converts to common and you're all treated exactly the same. That's really a nice place to be. All right, so for angels, these are just wealthy individuals or groups. Like Atlanta Technology Angels, they'll try to bundle up multiple small investments into the company. There's other places like New World Angels down in South Florida will do similar things, but you may have individuals as well. And they're gonna put money in. The smaller amounts, they're gonna expect in their angel round to take anywhere from 15% to a third of the company, for whatever they put in. And they're gonna do this with a convertible note or a safe note. That's how it's gonna go in, and that's the percentage they're expecting to get out of it. There's a lot of things that you can do. They're gonna more than likely ask you for a board seat, which, that's okay, but you have to sunset them. Angel investors, by and large, do not bring anything positive, long-term to board governance on your companies. And for those of you who maybe are angel investors sitting on boards, maybe I'm offending you. Maybe I'm offending myself right now. I'm an angel investor in 2 different companies and I'm on the boards. And sometimes I offend myself. But, most of the time, investors, and this is also sort of a sidebar, investors that you're talking to, whether they're venture capitalists or angels, they don't know your industry. They can't help you out on operating questions. Some angels can do that. The companies that I'm on boards of and participate in, they're in my industry. I don't do anything outside medical devices. And I prefer to stay in the therapeutic realm or the diagnostic radiology realm because I actually know something about that. And I know people in that space. And I know I know some of the big companies and the people who are in business development or mergers and acquisitions in that space. So when you put people on your board, be thinking about it. You want them to not just get a board seat because they put money in. That's called neutral money. You want smart money. They're bringing something, a Rolodex, connections, or they were involved in an operating role previously, recently, so they really understand how things work. And then they can actually help you. But then you've also got, I'll call it stupid money. And those are the people that get on your board and they actually just disrupt things. And you're gonna find all of those too. So just spend as much time trying to vet any potential board member as you would somebody you're hiring in, to be a co-founder, a VP, or something like that. They can really benefit you or they can really blow your stuff up. So sunset them. And by that I mean when you do the next round of financing, hopefully a Series A or something like that, have it in your documents. They're gone from your board. That way there's no argument. You don't have to go through all sorts of machinations. They know ahead of time what their leaving date, their expiration date is. We had on one of the first companies I was on board with, we had a triple board certified physician who, it was his idea, and he was on the board, and we went into our second round of financing, and we finally had to remove him because he didn't bring anything to it. And that was the most exquisitely painful experience for just about everybody involved in that if you can avoid it, try to do that. Those angel investors, they're gonna get diluted out to the point where they're just sort of along for the ride. Yes?
I have a question about the board of members. So essentially you have like a group of angel investors together who are investing, right? So then how can you just choose like one of them, or is it like the whole group is essentially like on the board?
No, what they'll do is, and I will talk about this in a little bit, but it's what you'll typically do is if all of these angel investors just stay unaffiliated, nobody's got a big enough economic piece of the company to rationalize a board seat. So you don't even have to worry about them. But if they pool all of their money, if they syndicate it, then they can say, you know, I represent investors that own 20% of your company now. I want a board seat. I did that before. And then you can say to that group, all right, you nominate one person for that, but they have to be agreeable to us. And then that becomes a bit of a negotiation. You can tell them, here's what we're looking for. We want somebody who's got either connections, they've got operating experience, or they've been involved in mergers and acquisitions in this industry. Those people and those investors should be fine with that if they have somebody like that, because they're actually putting somebody up on the board who can actually help them out. This is getting everybody to row in the same direction. That's what that is. So yeah, that's a great question about it. So that's the only time that they can demand it is when they pool, and then it becomes just a negotiation as to who. They can try to force one person on you, but you can, if you've got a valid reason, you know, like they're a felon or something like that, you can say, nope, you can't. We're not taking any felons and stuff like that. So angels typically use those convertible notes and safe notes because they do not know how to value a company. They just don't know how to do it. Venture capitalists are allegedly professionals at it. If you want to know the truth, they're just as good at it as angels. They've just been doing it for so much longer. They do have a little bit better eye for that kind of stuff. But angels won't do that, so they won't lead around. That's why they use those convertible notes and stuff like that, because they're not establishing that pre-money valuation on the company. All right. So, this is exactly what we were just talking about on the board members and stuff like that. What you really want to do with if you have a lot of angel investors, and this is something like ATA was notorious for, is they'd have $2,500 from one member, you know, $5,000 from another member, and they get 15, 20 people, and they'd finally be able to write a $75,000 check. But a lot of them would just, I just want to be an individual shareholder. Don't do it. Because if you have 500 shareholders and you've only raised $1 million, rounding up all those shareholders for shareholder required votes and stuff like that, trying to get, you know, a majority or a super majority of them, it is enormously painful and a time waster. So get them all to just syndicate into an investment LLC where you have one shareholder instead of 45. If you do that, your cap table is simpler. Your ability to get your shareholder votes executed is much easier as well. So that's one of the things about getting rid of a lot of little shareholders if you can do it. If you're really, if your startup is a hot commodity, you can tell people, I've got a minimum, $25,000 minimum investment. If you don't write a check that big, we're going to keep going. This is a high quality situation to find yourself in. A lot of times you can't do that. But if you can get them to pool it up into a 25K at least tranche, you're in pretty good shape then. You can also call out what we call a major investor, and you can pick your limit, but $250,000 is pretty reasonable. They can have special voting rights, whereas everybody under that, they don't get any special voting rights. And special voting rights pop up for things like if the company wants to spend $250,000 on some capital equipment, that usually requires not only a vote of the entire board of directors and the CEO, but the super investors as well. They'll require that as part of the investment documents. And they're just trying to protect their investment money from not going to stupid things that they disagree with. So you can call somebody out and say, okay, we got major investors and you'll have a few extra rights. That is something that you can do. So take advantage of it if you can. Once you get to like a verbal agreement on the major terms, which are pretty straightforward, cap, interest rate, things of that nature, present them with your term sheet. A term sheet's usually 2 pages, and it just spells out all of the major governance, economic, and financial types of responsibilities for both parties. give them yours. Don't take theirs if you can, because they're going to write theirs very one-sided. I'm not saying you write one that's really one-sided, but be fair, and you're much more apt to have yours accepted, or you start the bargaining from your position. That's just something that I've seen that seems to work pretty good. Sunset all these people that show up as angel investors at your Series A. If you don't do it, your venture investors are going to make you do it. And that I've seen directly multiple times. And they're not going to walk in and say, we're the new investors, you guys are gone. They're going to make you, the CEO, do it. So, all right, so venture capital, it all starts after that seed round. There's multiple ones on that. So let's talk just real quickly. For those of you in different spaces, this is really targeting more the device space, but you can imagine PMA, class 3 devices in pharma and biotech, the timelines and amount of money is kind of similar. So Series A is going to get you through a lot of your early testing and product development work. You might be doing some preclinical studies if that's necessary. So that your Series A is small enough that it'll get that. For some things, you can do a Series B, like Series A is going to be like maybe up to 5, 6, 7 million, something like that. That'll get you a long way. I've only seen an $8 million Series A get a company to acquisition that actually went through sales and the whole 9 yards. I've only seen it once. I'm still amazed at what they did. And it was a Georgia Tech grad who did that. It was Vertera Spine. So very impressed with Chris Lee and his company. Series B, that's going to target, that's enough money for you to get your 510K if you're a class 2 device. That'll get it in. It will not get you over the finish line for a de novo though, because you're going to have to do a clinical study for that one. You can do your first in man if it's a class 3 or de novo. It will get you that far with it. And you can go through all your safety and performance types of work. Series C, now you're talking, this is usually a big round. It's probably 15 to 30 million or so. This will get you to commercialization no matter what your device is, with the exception of a PMA. It will not get you over the finish line for that one, because it takes about 150 to 200 million to get a PMA across the finish line. So that's going to get you into like a Series D, maybe a Series E. If you start your own sales force, you're going to be pushed into some of these larger rounds, because having your own sales force, like I mentioned earlier, it's very capital intensive. It just costs a lot to do that. If you have a down round in any of these rounds, it's going to trigger a ton of dilution. And all of that gets spelled out as some of the rights that individual investors like at Series C, if they do it at $4 a share, and they've got anti-dilution ratchets in it, and you do your the next series, and you do it at $3.50 a share, you're going to get hammered by that one. So there's a lot of dilution on down rounds, and that's why it's kind of good to be modest with what you're doing, particularly in the early days. This is what I think is the best book for understanding and seeing examples of all these different types of financings and all the different languages and requirements, governance, shareholder agreements, the whole 9 yards. This spells it out and even gives it gives mathematical examples of what happens to your cap table and stuff like that when you're doing all these different rounds. It's written by a couple of guys that are attorneys and venture capitalists. So it's very accessible. So that's really nice. So we're going to close out real quickly with what happens to you as founders when you start the company and you start raising money. So this is the dilution part of the talk. All right, so let's say you got started. You're going to issue 3 million shares of founders stock. It's just common shares. It sounds magical to call them founder shares. But 3 million, you're going to split it, not quite equally, between the CTO and the CEO. And that's a distribution. It's 60-40. So you're going to go in here. Since we're here at Georgia Tech, let's say we're going to go license our IP, because this is coming out of our lab. We're going to license from Georgia Tech. Now, I don't know if Georgia Tech would go for an 8% equity stake. I don't know. They've gotten more reasonable since they turned over that office. But this is an example, like, for example, that I did with Case Western Reserve. I was able to argue them down to an 8% equity stake at the beginning. They wanted it to be non-dilutive, which is like, you're crazy. You're crazy. You're going to own 8% of the company and put something in once? That's nuts. So But anyway, they get 8%. Well, guess whose hide that 8% came out of? Yours. You two guys in the back, you did it. So, all right, now, you think that's it. You got to get prepared for the next round of investors. Because at this point, you haven't made any sort of accommodations on stock for employees that you're now that you're about to raise money, you're going to use that to hire people who are going to accelerate your business. So the first thing they're going to require you to do is put aside a stock option pool. So you're going to have to issue more stock, common stock. And it's going to sit in a bucket. And as you hire people, they're going to get pieces of that bucket in the form of stock option grants. The typical request is by investors who are going to come in here in a minute is you're going to create a 20% stock option pool. Are you like mad to make that not that big? Are you at like 10%, 15%? Try to keep it down because guess where that 20% came out of? CTO, CEO, and the university. So everybody took a hit when you generated that. All right? Try to keep it down if you can. So now you can see where we are. You've gone from 60% as the CTO, you're now down, you've lost 25% of the company at this point. So here comes the angels, and what they're gonna do is they're gonna put in, say, 500,000 bucks, and they're actually gonna be very inexpensive. They're only gonna take 11% of your company. You negotiated really well with them. So that's all they're gonna do. But you can see what happened. Everybody who has common stock took a hit at that point. All right, these angels put their money in as a convertible note, so it hasn't actually caused a dilution on you yet, but when the next folks come in, then it will hit you. But effectively, that's what happened by bringing in that $500,000. So there's some nuances here, just want to make sure everybody understands. This is on an as converted basis because we're about to get preferred shares coming in the door, and that is a different class of share. So here comes the Series A. This is where we were just a second ago. And now we got some venture capitalists. They're going to come bring in some amount of money, and they're going to get 30% of your company, and they're going to get 2 million shares. So what you have to do is you have to create an additional 2 million shares of common stock because that's what their preferred shares at some point in the future will convert into. So you have to create it ahead of time, and that's why you're taking a big hit on dilution when they come in. So at this point, you're now looking at it going, half the company is gone, as far as I'm concerned, right? It's getting kind of painful, but you know what? These guys who just came in, they probably valuing the company post-money after their money hit, it might be $20 million. Now, that's not liquid. You're not going to get $20 million for that company yet, but you went from something that was valued zero when the two of you started it. Now it's got a virtual value of maybe 20 million, something like that. You're going in the right direction. That's the bottom line on that. So you have a couple more rounds. Now you're up to Series C, so let's see what that takes a look at. So Series B, after Series C went in, they got 18%. So that means they probably got closer to 25% on their round. And so this next round, this is big money coming in, and they're going to get 40% of the company. Look what it did to you. CTO is now down single digits in percentage. And what I would tell you is this is exactly what happened to me with Focal Therapeutics, except I started at 100% ownership. And it was worth that much when I had 100%. And by the time it got done, I was in the high single digits, but we sold it for 9 figures. So that was okay. That was actually a good outcome. So all of these different investors, they're now owning, you can add the numbers up. I mean, that's 2/3 of the company that they own at that point. But the thing is, you've created a lot of jobs, you solved some major healthcare problem, and you're going to end up selling the company, and you're going to make a lot of people a lot of money, including yourselves, in addition to having solved a real problem. And all of that extra money that you made and you've generated, I mean, it's almost like you created it, I won't say out of nothing, but quite frankly, you did. And guess what? You're going to put that to work. Those venture investors are going to put that to work. And it's going to leverage the next set of startup companies that come down the pipe. That's the beautiful thing about this. And I don't want anybody to think that it's all about, making just boatloads of money on this. That's good. If you do well, you will do good. But you're going to benefit humanity by creating stuff that they need. And you create a lot of extra money that's available to enhance the next set of startups. So that's part of what I really love about doing this kind of thing, is you can really have a greater impact than you think you're going to have when you're immersed in it right now. So that's what you own. That's about it. So I'm just going to show you what we did at the first company. We raised, in Proxima Therapeutics, we raised $50 million total. And here's what the share prices were. So we did not do a down round. We did one flat round on there. The Series B to Series C was flat. And we went all the way up to a $7.20 a share on the Series E. So we sold the company for $200 million to Cytec. So globally, for the amount of money we raised, we got a 4x return on that $50 million. But if you look at the folks, you can see the people who were in at the Series A, they got a damn nice return, 14.2x. These guys down here, they had their money at work for maybe 18 months, and they got a 2x. This is awesome. You don't see a 2x in that kind of time frame usually from anything that doesn't have a ton of risk. But at the point we did this, we had 2 products in the market, we had 2 sales forces, we had a lot of revenue, and all we had to do is get it to cash flow break even. Because when you hit that magic number, cash flow break even, public companies, who are the people that buy these startups, you're now going to be accretive to earnings, which means it's open season on you. They will do it. If you're not profitable, you will hurt their earnings per share, which translate directly to dinging their stock price. If you add to their earnings per share, you enhance their stock price, they love that. They will buy that all day. So with that, I'm going to just go ahead and open it up to questions here, questions in the chat. Maybe Morgan can help me out with that a little bit, but
Let's give James a little round of applause. Thank you.
you're welcome.
So, folks online, if you can hear me, you can stick your questions in the chat or the Q&A function, and I will grab those for James. Otherwise, folks in the audience.
You alluded to this a little bit right out of the gate, but is the weather getting any better for early stage, especially for first-time founders?
It seems like it's making it's kind of down. It's down. I don't know if we're fully in the nadir or not, but it's down like this right now. And what was so strange is, and this is why I don't want to try to predict anything. When the pandemic hit, my first reaction was, "Oh Lord, we are in deep, you know what." And for like 3 months, we were. I mean, we had elective surgery shut down. A lot of the companies that I was familiar with, you couldn't generate revenue. But then all of a sudden, we got into 2021, and it's like the venture community went absolutely nuts. And they started funding all these stupid startup ideas with atrocious valuations. And by atrocious, I mean big. And so these companies would raise enormous amounts of money, $15, $20 million. They wouldn't take a big hit on dilution, and they would staff it up, and they burnt through it in 9 months, thinking, that was easy. I'll just do it again in 9 months. Well, guess what happened? The environment turned completely on its head, and they couldn't get any traction in the investor community. And they ended up doing huge down rounds, or they couldn't get any funds at all. And the companies that raised some money kept their burn rates rational, and they had a longer runway. They were able to move right through that suicidal valley right there. And most of them seem to survive, and they've gotten to the point where the venture community looked at them and said, okay, you guys were actually good stewards of the money. You did it right. Well, we'll consider participating with you, but it's those ones that were just horrible at it. I mean, they were like radioactive.
I have a question about the Silicon Valley Bank collapse. So I don't really know a lot about it, but I know it did affect the startup community. I guess I was wondering, do you think that the reason behind it is that maybe there's too much centralization in there? Like, do we need like another bank, or like what exactly was?
Okay, so I have to tell you that Silicon Valley Bank caused more indigestion, diarrhea, and other problems in our community than you can ever imagine. And the reason, at the end of the day, Silicon Valley Bank was very irresponsible with the funds that they had. They had an enormous amount of venture capital that was invested in all these companies that went into their bank, and they bought government bonds with it, because that's largely what you did, what you had to do for banking regulations and stuff like that. But when interest rates shot up, the value of those bonds dropped. And they looked at that and said, oh crap, we're not capitalized the way we were supposed to be. We're going to have to sell, stock in Silicon Valley Bank in order to recapitalize and be able to deal with this. And it almost totally wiped them out. And the problem was, and this is where I started to get a little upset with a lot of the commentators on the street saying we shouldn't bail out Silicon Valley Bank. You didn't bail out Silicon Valley Bank. I had at least one company that had $35 million of their cash in Silicon Valley Bank, and they couldn't get it out because Silicon Valley Bank said, we ain't got no money. You weren't hurting by that was not hurting Silicon Valley. Silicon Valley Bank was dead at that point. But that bailout allowed all of those companies that had their money in there, it allowed them to keep operating. So Silicon Valley Bank was just like this really weird animal, and they had a lot of special things that they did for the entrepreneurs and stuff like that. And some of that stuff, they started to think that they were invincible. So I think we're seeing a little more rational banking behavior with respect to where we put our money when we do like a $10 million round. We're putting them in Bank of America, putting them in JP Morgan and places like that. Too big to fail? Yeah. Put it in places too big to fail. That's at this point in time, yes. I mean, we saw that was one of the biggest black swan events of 2023. And it got avoided being a total meltdown for hundreds of thousands of people. And so for once in my life, I said, thank you, government, for doing something, okay? But yeah.
A nuanced opinion of government regulation.
Yes, the scales have moved a little bit with respect to
some questions in the chat, if I can
Okay,
ask you.
sure.
One, I'm just going to talk in the mic so others can hear. How common is it for startups to skip the angel investor phase and seek funding from VCs directly, especially if they're close to a complete tech?
And generally speaking, that's kind of rare. I haven't seen a lot of that because normally when you take a large tranche of money for the first time, you're going to drop 40% of your company, and you would if you're smart, you would probably benefit from taking a smaller amount of money and giving away a smaller percentage of your company and accomplish some actual value-added milestones so that the next set of investors will look at it and go, you actually did something with the money, and now you've accomplished something. We think your company's more valuable. And so let's say you doubled the value of your company. Now you can take the same amount of money, and you're only going to get half as much dilution on the second round that you did on the first round. So I think it's really rare for you to go, and the only time I would see this actually happening is you got a CEO and his management team or her management team, and this is their third or fourth rodeo. They've done it 3 or 4 times before in the same space, and they've gotten liquid every time at a high multiple. In which case, you'll see the venture community go, we're betting on you, you're damn near a sure thing. In which case, you might be able to do it. But they're still going to look for 25% or so ownership of the company in a case like that.
Jake asked about the relationship between large companies and startups. what types of investments do these companies make in technology that they might believe to fit into their portfolio?
So with a lot, and hello, Jake. It's been a while. We'll catch up shortly. One of the things that you can get a larger company that's in your space, like let's say you're creating a product that would fit into their product portfolio. Let's say it's a urology type of technology. Somebody like a Bard/BD, that maybe they don't have that specific technology, you would be something they could bolt right into their business. And they may look at that and go, well, you know what? We want to try to enhance your abilities to succeed in that development, so we're going to actually do an investment in your company. And they'll become basically a big investor on one of the medium rounds. If you're doing a PMA, for example, you're almost certainly going to have at least one strategic corporate investor involved in it. And this is good for you because if they've got $50 million in your company, they also probably got first negotiation rights to acquire your company when you get your PMA cleared. This is real common. Does anybody remember CardioMEMS? So that's, CardioMEMS got picked up as soon as their PMA cleared. It's like that triggered the acquisition. Because you might have remembered earlier I talked about you have to get to cash flow break even before you're typically eligible for being acquired. The PMAs are the exception. If you have a strategic investor and they've already got 50, 100 million in you, they already own 30% of you, and you're going to be a bolt-on and you can go right into an operating business unit that exists with a lot of salespeople, they'll do that then. So yeah, there are some ways that you can do strategic partnerships. You can do it in forms of joint ventures. You can take an investment from them. There's always going to be additional strings attached to them doing that.
Any other questions from audience folks? All right.
Last one, is it typical for universities like Emory and Georgia Tech to take equity in the company beyond licensing the IP? What if it's a software company and there might not be any IP? I'm curious what you think of this, but there's always IP. It just depends on how you protect it. Might not be a patent, but it could be copyright or...
Yeah, there's always going to be some kind of IP with straight up software companies. Maybe it's going to be trade secreted and stuff like that. But in general, they're almost always going to get started by taking some sort of equity stake in it. Here's one of the things that my initial reaction to university licensing, just why would I want to license something from a university? They're just taking one, stock in my company, and two, a piece of my cash flow. If they're taking like an 8% royalty, guess what? That 8% royalty comes right off my top revenue line, which hurts the multiple that I can get for the company when it comes to be acquisition time. The other side of that coin is if I'm a startup and somebody in, say, Medtronic wants to infringe my patents or assert their patents against me in my IP portfolio, I don't have the $2 million it takes just to get to what they call a Markman hearing in the IP space. It's going to bankrupt me. They think twice if Georgia Tech or Emory, one of these 800-pound gorillas, is on the IP side. If they own it and they're willing to back it up and say, we're gonna protect you. We'll prosecute anybody who infringes, and we'll help you if somebody asserts that against you. That is an enormous disincentive for somebody to play dirty with you. So that's something about my thought process that has changed over the years with respect to university and having them own some IP. You can buy them out later if you want to. A lot of times after acquisition, the big companies will buy out the royalty stream because they want to capture all the royalty, and they'll go ahead and buy them out. They'll do a future cash flow type of valuation and buy them out. Georgia Tech will love that.
I have a follow-up question to that. So then let's say if you are a successful startup founder and you start out with IP initially from a university. So then after that, let's say if you kind of wanted to like own your own IP, in that case, would you have to like, I don't know, assemble your own lawyer team? Like how do people go about that usually if they want to own their own IP?
So I'll tell you how It really works. And I hope there's nobody from the Office of Technology Licensing.
Stop the recording?
Yeah, we should stop the recording and kick at least one person from memory off. But here's how it oftentimes happens in reality is you'll license IP from the university and you hope that it's covering the first product that you're going to build and commercialize, that the claims on the issued patents read directly on what you're building. But the first thing you're going to do is you're going to start trying to figure out how do you change your product so that it no longer falls under the claims that you license. And you'll start doing your own IP filings and stuff like that. If the university's smart, they're going to require as part of your license that any derivatives of the work that you do belongs to them as well. But sometimes you can work around that. And a lot of times, and I've personally seen this, that they work really hard because the revenue, the royalties are governed by product sales that are being, the product actually functions as described in the license, the IP that you license. So you try to create an adjacent IP space that's yours. You can try to get and buy out that IP that you did license. You could just do like a fully paid up license and get the exclusive rights to it. You can do that. It's usually going to be very expensive, both in cash and time to go do it. So it's probably not worth it. All right, well, I have absolutely exhausted everybody's time and energy, so
Thank you all.
Thank you all
Folks on
very
Zoom.
much.
Another round of applause for James. Thank you.